Tab 2.
That's called the study guide.
Study guide, exam guidelines. Tab 2, the very first page. You'll see where it says heart rate, body composition, blood pressure, and body composition. If you watch, you'll see me follow along this. This is your practical exam. There's nothing different on the day of the test. This is it. So you can start focusing some of your study time to go exactly along this one. If you notice when we do the presentation, I'm going to cover each and every one of these boxes. This is what your examiner is looking for, that you can dispense this information. The other thing they're looking for is that you can do the practical skill side of that. Actually taking their heart rate, taking their blood pressure, and showing how to do the body composition. Remember that you have 15 minutes at each station, okay? So if you follow along, this is what Dahilia and I are role-playing. She's the examiner, and I'm going to be you.
Can somebody,
Yes.
yes.
15 minutes.
15 minutes.
Doesn't matter. Just okay. So when they facilitate the exam, they're going to ring the bell, and we can't have that. We don't learn bandages.
I didn't break it.
Yeah, right. Ready? Start.
So you walk up.
Hi. This is Cindy. This is blood pressure, heart rate, body comp. Would you sign here, please?
Yes.
How you doing?
Ask me after I'm done.
Okay. Well, we have 3 scales: heart rate, blood pressure, body comp. What do you want to start with?
I'd like to start with heart rate. Heart rate is the number of beats per minute that your heart beats. We have several different kinds of heart rates. We can do this thing called a resting heart rate, which is taken first thing in the morning for 1 full minute. It's taken on 3 separate days, and I take an average of those 3 days, and that tells me what your heart does at rest. We have this other thing called the maximum heart rate, and it is an age-predicted formula that says 220 minus your age. If I take your maximum heart rate and you subtract your resting heart rate from that, that gives me training heart rate reserve where all activity occurs. I can do this other thing to monitor your exercise heart rate called the Calvonen formula. It's maximum heart rate minus a resting heart rate times an intensity of 50 to 85%, and I add your resting heart rate back in. That gives me a training or a target heart rate zone. There's this other thing called the Borg's, RPE, or rate of perceived exertion. There's 2 scales. One scale goes from 0, the other scale goes to 10. 0 is easy, 10 is the most difficult. We have another scale that is from 6 to 20. 6 is the easiest, 20 is the most difficult. As my client, you are perceiving your exertion, and this is going to show me at what degree your heart rate is working. There's another one called the talk test. If you can talk back to me without any increase in oxygen, you're not working out hard enough. And you start to labor for breath. I know that intensity is too much. I need to bring that back down. When I take a client's heart rate, I want them to be seated and resting. I can take the heart rate for 1 full minute. I can take it for 30 seconds and multiply by 2, 15 seconds and multiply by 4, 6 seconds and multiply by 10, or 10 and multiply by 6. When my client is exercising, I expect that heart rate to get elevated during exercise. But after a period of time, that heart rate should become more fit and they should be in better health. Let me take your heart rate now. Where I can take a heart rate as a trainer is 3 sides. I can take it in the carotid artery located in the neck. I can take it on the radial artery located on the wrist. We can take it in the brachial artery. The book says the temporal. Never done that yet before. But if you'll just have a seat, I'm going to count your heart rate. Is that one broken? No, because your heart rate's going to change. So your heart rate would be 64 beats per minute. I'm multiplying that by 4. Blood pressure. Blood pressure tells me the force of blood that goes through the arterial walls. There's 2 numbers to that. We have the systolic that tells me how much blood goes out when the heart contracts. We have the diastolic that tells me how much blood refills in the heart's chamber upon relaxation. Average ranges of a blood pressure on a systolic are 100 to 140. 60 to 90 on a diastolic. If somebody's 140 over 90, that's borderline hypertension. And if they're 160 over 100, I definitely want medical clearance to work with them. When I take a blood pressure, I need my client to have been in a relaxed, quiet setting about 10 to 15 minutes. I want the feet flat on the floor and not crossed. Blood pressure can be taken in the right or the left arm, but preferably it's in the left arm. We want that arm to be resting either below or equal to heart level, not elevated above. What I will do is I'll palpate and feel for the brachial artery. When I find that brachial artery, I'm going to place my cuff so that it can be over that artery. I want to secure my cuff so that it does not go over the elbow and compress on a joint, but it's slightly above the antecubital space or the little crease in the elbow. I want a secure fit in that cuff so that when you lower your arm, the cuff doesn't roll down. Now, if I do have somebody who is very muscular with a lot of biceps or they're obese, I will use a large adult cuff so that I can get an accurate reading. I'm going to place the stethoscope over the artery and press. I'm going to pump the bulb up, closing it, until I no longer hear your heartbeat and go 10 millimeters past that. Little pressure.